Never do this when you urinate. It can silently damage your prostate. If you've recently found yourself getting up 3, 4, or even 5 times in the middle of the night to go to the bathroom, if you notice your urine stream is weak, or worse, if you always have that uncomfortable feeling that your bladder never empties completely, then what you're about to hear is crucial for your health as a man. Few people know it, but between 7% and 8% of men over 50 make a serious mistake when urinating every day, believing it's completely normal, when in reality, it's silently damaging their prostate. Today, I'm going to reveal this common yet dangerous habit that's affecting your bladder without you even noticing. And I promise you something. If you stay with me until the end of this video, you'll not only discover what that mistake is that you repeat every day in the bathroom, but you'll also learn the correct technique to start using today. This simple correction can help reduce prostate inflammation, improve the force of your urine stream, achieve complete bladder emptying, and, most importantly, allow you to sleep soundly through the night, without interruptions, discomfort, or trips to the bathroom every few hours. This problem is silent, intimate, and wears down your quality of life more than you can imagine, my friend. Join me, because what you're about to discover can change your bathroom routine forever. Hi, I'm Dr. Daniela Ramirez, a urologist with over 15 years of experience. Throughout my career, I've treated thousands of cases of prostate problems that affect men's lives, energy, and even self-esteem. And I'm telling you this with complete sincerity. Many of these problems could be avoided if men changed a simple urination habit. Today, I want to talk to you about something that will surprise you, because, incredibly, most men have no idea what the correct way to urinate is or the direct impact it has on their prostate health. Most people take it lightly, as if it were a minor detail, but the truth is that a bad urination habit can trigger a chain of consequences that end in benign prostatic hyperplasia, chronic prostatitis, and that desperate need to get up several times a night to go to the bathroom. And let me tell you something clearly, my friend. Many men tell me, "Doctor, I'm getting old. It's normal to get up so many times, right?" The answer is firm. No, sir. That is not normal, nor does it have to be your destiny. To understand why this mistake is so harmful and how it's sabotaging your rest and your quality of life, I first want to explain in simple terms how your urinary system works. Imagine your bladder as a water balloon, like the ones we used to play with as children, a muscular balloon designed to store urine. Right below it is your prostate, a small gland about the size of a walnut that surrounds the urethra. That little tube through which urine passes when you go to the bathroom. The prostate acts as a kind of valve that regulates the flow of urine. Now, there's something you should know. With age, and this happens to all men without exception, the prostate tends to enlarge. And this is where your greatest enemy appears. That habit you have every time you stand in front of the toilet. Because without realizing it, you're exerting constant and brutal pressure on a gland that's already sensitive due to the passage of time. And now it's time to reveal what I promised you. Listen carefully, because this could change your life. The most damaging mistake you make when you urinate is pushing or straining with your abdomen to speed up the flow. Yes, you heard right. That straining you do, that effort to make it come out faster or to finish emptying it, is hurting your prostate. I know exactly what you're thinking. But Dr. Daniela, sometimes the stream is very weak, or it takes a while, or it stops. What should I do? It's normal to feel that urge to push, especially when you're in a public restroom, in a hurry, or when you think you're almost done, but there's still a little bit left. Believe me, I hear it every day. I've been hearing the same concern for over 15 years. But you need to understand what happens inside your body when you push. By straining, you create what we medically call excessive back pressure. Instead of allowing your bladder to do its job naturally, calmly, and efficiently, you're forcing your body to expel the urine by force. That extra pressure doesn't disappear. It travels directly to your prostate and bladder, irritating and weakening them over time. Your prostate, which is probably already a little enlarged or inflamed due to age, is directly impacted every time you do this while urinating. I want you to visualize it clearly. It's like giving your prostate an internal pull or push several times a day, every day, for years. Can you imagine the mechanical wear that causes? That repetitive stress acts like a constant hammer blow on a gland that's already sensitive and vulnerable. And over time, that damage accumulates. But the problem doesn't end there. There's something even more delicate, much more dangerous. And that's what we in urology call urine reflux. What does this mean? Think about it. Instead of the urine flowing out as it should, when you push, you create so much pressure that some of the flow goes backward, getting trapped inside your bladder. That unexpelled urine, that fluid that remains stagnant there, is medically known as post-void residual urine, or incomplete urinary retention. And here's the serious part, brother. That trapped urine becomes a perfect breeding ground for bacteria to multiply. The result? Recurrent urinary tract infections. And each infection further inflames the prostate, which worsens the symptoms. See? A devastating vicious cycle forms: pressure arrow inflammation, arrow retention, arrow infection, arrow more, inflammation arrow, more pressure. A wheel that keeps turning and can consume you for years if you don't make a change right now. But listen carefully, because what I'm about to tell you could be a game changer for your sex life. This straining habit doesn't just affect your prostate, it also confuses your bladder and the muscles that control it. Inside your bladder, there's a main muscle called the detrusor. This muscle is responsible for contracting to expel urine naturally, without any external effort. But when you interfere and help it by straining with your abdomen, what do you think happens? Exactly. The detrusor gets used to having it done for it. It becomes lazy, slow, dependent. Over time, it loses strength, loses tone, and loses its ability to contract fully. In medicine, we call this an underactive bladder, or sluggish bladder. The consequence? You start feeling the urge to urinate constantly, even if you just went 20 or 30 minutes ago. Why? Because you never completely emptied your bladder. There's always a little bit left inside, getting in the way. And of course, this forces you to get up 3, 4, or 5 times during the night, ruining your sleep, disrupting your rest, and affecting your physical, mental, and emotional health. Don't underestimate this, I urge you. I've seen it in my patients time and time again. When you don't sleep well, your energy plummets, your mood changes, you get irritated easily, you lose concentration, and even your sex life and daily performance suffer. In other words, this bad habit isn't just damaging your prostate, it's robbing you of your rest, your vitality, and that feeling of total relief after using the bathroom. Now, before you say, Dr. Daniela, I'm doomed, I've ruined my bladder, I want you to take a breath and listen to something important. You still have time to fix it. The solution exists. It's natural, it's free, it doesn't require medication, and any man can use it. But it does require one thing: commitment and consistency. The technique you should adopt starting today is called relaxed urination. Remember this well. Urinating should be an act of deep relaxation, not effort. I'm going to explain step by step what you should do. When you feel the urge to urinate, go to the bathroom without waiting. Don't hold it in or postpone it, because that also damages your bladder. Once there, give yourself permission to take your time. Nobody is timing you. Instead of pushing with your abdomen, like you've done your whole life, you're going to do the exact opposite. Relax. Relax your abdominal muscles. Relax your pelvic floor. Loosen your posture. Imagine simply letting your urine flow, as if you were turning on a tap. Let gravity and your body do the work for you. Zero force. Zero rush. Focus on your breathing. Inhale deeply. Exhale slowly. Release your shoulders. Release your chest. Relax your diaphragm. And allow the flow to begin, continue, and end naturally. And now, listen carefully, because this detail is key. If the stream stops before you feel you've finished, do not fall into the temptation of straining to expel what's left. That habit is exactly what we need to unlearn. When the stream stops, don't do what you've always done. Instead of pushing, simply stay there for a few seconds in complete silence, with your body and bladder totally relaxed, without any tension. That brief moment of pause is pure gold for your urinary health. You're giving your detrusor muscle a second chance to activate on its own and complete the expulsion of urine without you having to force it. That patience, that conscious and serene waiting, is one of the most powerful pillars for protecting your prostate in the long run. And now that you know how to urinate correctly, I want to help you solidify this new habit. I'm going to give you 3 additional tips that I consider. These are fundamental tips that have transformed the lives of hundreds of my patients throughout my years of experience. Listen to them carefully, because if you apply them, they can be a game changer for your health. First tip: the position in which you urinate. I know that most men prefer to urinate standing up because it seems faster, more practical, and manly. But if you're already experiencing signs like a weak stream, dribbling at the end, or that annoying, constant urge to go to the bathroom, you need to listen to this without judgment. Several scientific studies have shown that the seated position is the most effective for achieving relaxed, complete, and effortless urination. Sitting allows you to relax your pelvic floor muscles, facilitates the natural flow of urine, and significantly increases the likelihood of emptying your bladder completely. I know that culturally, especially here in Mexico and in many Latin American countries, many men are uncomfortable admitting that they urinate sitting down. But let me tell you something with both affection and medical authority. Your prostate will thank you profusely. This has absolutely nothing to do with your masculinity. It has to do with your health, your well-being, and your sleep. Second tip, and it's key: never rush. Give your body the time it truly needs in the bathroom, even if you have to stay there for an extra 30 seconds, 1 minute, or 2 minutes. If you're in a hurry and know you're going to end up straining, it's best to wait and go when you can do it calmly. Speed is the enemy of your prostate. Your body needs you to be patient and respectful. Third tip: I'm going to share a more advanced technique that almost no one knows about, but which is extraordinarily effective: double urination. What does it consist of? Once you've finished urinating calmly, without pushing, lean slightly forward, either sitting or standing, and wait 5 to 10 seconds. This slight lean changes the position of the bladder and urethra, allowing that residue of urine that sometimes gets trapped to come out. This simple gesture can help you empty your bladder more completely, drastically decreasing how often you need to go to the bathroom during the day, and especially at night. Now, I want to answer a very common question I receive on my social media, and right here in the comments, because I know many of you can relate. Dr. Daniela, if I don't push, I feel like not everything comes out, and then a little bit leaks into my underwear. What should I do? Is there a device or prosthesis to solve this? Excellent question, sir, and I'm glad you asked it. That dribbling that appears afterward is precisely a consequence of residual urine retention, which I mentioned a moment ago. The solution isn't to push harder, that only worsens the problem, but rather to use the double voiding technique. Finish, wait, lean forward, and let your body do what it needs to do naturally. Now, regarding devices or medical procedures, there is help available when the case is truly severe. In cases of advanced benign prostatic hyperplasia, BPH, we have alternatives such as urethral stents, which are small tubes that keep the urethra open. There is also a more modern procedure called urolift, which places tiny implants to lift the prostatic tissue that is obstructing the flow of urine. But, and I want to make this very clear, these treatments are for severe cases when the obstruction significantly affects quality of life and there is no other option. Before even considering surgery or devices, my professional recommendation is that you practice the relaxed voiding technique for at least 30 consecutive days. Give your body 30 days to relearn, to unlearn the bad habit, and to recover its natural function. I have seen incredible transformations. Patients who arrived desperate, exhausted, on the verge of surgery. And simply by correcting this habit, they regained their rest, their energy, and their lives. Don't give up before you even try. Your body knows how to heal when you give it the chance. And since we're on this topic, I want to clear up another very common question. Do women also get up several times a night to urinate? Yes, women can also suffer from nocturia, which is the medical term for repeatedly getting up to urinate at night. But in women, the causes are usually different because they don't have a prostate. Their reasons are related to other factors such as pelvic floor weakness, infections, or hormonal changes. In the case of women, the story is different. They can also wake up several times a night to urinate, but for completely different reasons. Pelvic floor weakness, urinary tract infections, hormonal imbalances, diabetes, or simply consuming fluids too late. But that's such a broad and specific topic that it deserves its own video. This entire section is dedicated especially to our dear ladies. Now, I want you to step out of the bathroom with me for a moment and consider another equally important aspect: your daily lifestyle. Because while proper urination technique is fundamental, there are habits outside the bathroom that greatly influence the health of your bladder and prostate. One of them is hydration. And listen to this very seriously, my friend. Drinking water properly can be your best ally, or your worst enemy if you do it wrong. You need to drink enough water throughout the day, but distribute it evenly from morning to evening. The mistake many make: drinking large amounts of liquid right before going to sleep. That's a surefire recipe for restless nights. I always recommend to my patients that their last glass of water be no more than 2 hours before bedtime, to give your body time to process it and avoid overloading your bladder during the night. And here's a crucial point. If you want real improvement, you're going to have to drastically reduce your caffeine and alcohol consumption, especially in the afternoon and evening. The reason? Both caffeine and alcohol are powerful diuretics. Your body produces more urine, and they also irritate the bladder and prostate, making you need to go to the bathroom more frequently. Coffee, black tea, energy drinks, caffeinated sodas, beer, wine, cocktails. If you have prostate symptoms, they're all working against you. I'm not saying you have to eliminate them completely if you don't want to, but you should moderate your consumption, because your prostate needs a break. Speaking of home remedies, I recently read a comment from a gentleman who said he drank Coca-Cola with lemon and slept better that night. Look, I respect everyone's experiences, but as a doctor, I have to be honest with you. Coca-Cola is full of sugar and caffeine, and although lemon has anti-inflammatory properties, that combination is not a recommended or scientifically supported treatment. That it worked for him once could have been a coincidence, a placebo effect, or the result of something else. I have to give you real solutions, with medical evidence and proven results, not improvisations. Let me give you a very clear summary of what we've learned today, because I want you to take this message home with you. The big mistake that's damaging your prostate day after day is pushing with your abdomen when you urinate. This effort creates intense counterpressure that further inflames the prostate, promotes residual urine retention, increases the risk of infections, and traps you in a painful and exhausting cycle that becomes increasingly difficult to break. The solution is literally within your reach, starting today. Relaxed urination. Breathe deeply, relax your abdomen. Let the urine flow on its own without interfering, without pushing, without rushing. If you add to this urinating sitting down when you have symptoms, never rushing, using the double voiding technique, staying properly hydrated during the day but reducing fluids at night, and moderating your alcohol and caffeine intake, the changes you can experience are impressive. With these simple yet powerful adjustments, you'll not only be protecting your prostate, you'll be getting better rest, reducing or eliminating infections, feeling lighter, more comfortable, more like yourself. You'll wake up refreshed. You'll feel new. And I say this with complete certainty because I've seen it hundreds of times. If you felt this information opened your eyes, if you learned something no one had ever explained to you clearly, I ask you a favor from the bottom of my heart. Like this video and share it with a friend, a brother, your dad, your best friend, or that neighbor you know suffers in silence. Many men experience these discomforts without saying anything out of shame or lack of knowledge, and you can be the one to share the solution with them. Now, I want to extend a personal invitation. Practice the relaxed urination technique for the next 14 days. Just 2 weeks. And then come back here and tell us about your experience in the comments. Did you sleep better? Did you get up to go to the bathroom less often? Did you feel relief or improvement? Your real results can inspire other men who are still hesitant to try it. I invite you to subscribe to my channel, Dr. Daniela Ramirez, where I share clear, practical, and direct information about men's health, the prostate, intimate wellness, and those topics we're sometimes embarrassed to ask about, but which are essential for living life to the fullest. And before I say goodbye, I'll leave you with a sincere question. Do you usually urinate sitting down or standing up? I can tell you we're going to be surprised by what we discover together. Take good care of yourself, and remember, your health is in your hands. Don't neglect it. See you very soon in the next video.